Hi, welcome back, everyone. So today we're going to start talking about physical activity. So let's jump right in and get started. As usual, we're going to talk about following guidelines set by the American Diabetes Association for most people with diabetes. So the guidelines are that you want to try to build up to having some physical activity 5 days a week for at least 30 minutes each day. Now remember, you want to talk to your healthcare provider before you start any physical activity routine, especially if you haven't been following one in a while, to make sure that you're not going to have any trouble. It's especially important for people that have diabetic retinopathy, or maybe you've got some neuropathy in your feet, or you've got some heart conditions. So talk to your provider first, okay? The other thing is we're going to start slow and we're going to build up to that 30 minutes a day, 5 days a week, especially if you haven't been exercising regularly up to this point. So this, if you remember from session 5, those SMART goals that we talked about. So this is a really good time for a SMART goal because this can help you choose your physical activity, figure out what are you going to do, when are you going to do it, and where are you going to do it? When are you going to start? How long are you going to track yourself for before you stop and reflect to see if you're meeting your goals or not? Now, one of the things you want to do before you just go jumping in is pick an activity that you enjoy. Maybe you've got a really active dog and you want to start going for walks. Maybe you like to have music playing in the kitchen while you're cooking. And, you can just leave that music on and dance around in the kitchen for a while afterwards. Whatever it is, make sure that it's enjoyable. You can play catch with your kids, whatever you like. So now let's figure out what day of the week are you going to do your activity on? Is the weather going to be good? Are you going to have all the equipment that you need? Make sure you've got your plan, and then you can get started. So actually, I'm going to let you in on a little thing. I have fallen by the wayside with my own physical activity, so I wrote my own SMART goal. So my SMART goal is to start, today's a Friday, so my goal starts next Tuesday. And on Tuesdays and Thursdays, from 5:30 to 6 in the morning, I'm going to do my yoga class. Now I have a SMART app for that I use, and I'm going to do that for the 4 weeks of December because I'm going to start slow. I used to do it every day, 6 days a week, but it's been a few weeks, so I'm going to start slow. At the end of December, I'm going to check myself, see how well I did or how well I didn't do, and then I'm just going to keep moving forward with that. So, maybe this is a good time for you to want to try doing a SMART goal towards physical activity as well. And in a few weeks, I'll let you know how I did, okay? So, again, we're going to slowly work up to that 150 minutes a week. That's 5 days a week, 30 minutes. And we're going to check with our healthcare provider before we get started. Before we start to run down on time, don't forget, go to diabetes.org. It's on the slide for some additional ideas to be physically active. Go on YouTube. There's all kinds of great stuff there. There's chair exercises. There's walking at home. All kinds of exercises for beginners there. Ask your friends. Check your smartphone. Most smartphones have an app to track your steps. If you even want to just start with that, there's a nice, easy way to get started. And we'll see you next time, okay?